In situations where there is increasing number of cases and the health system cannot handle all of them in the hospital, both in terms of infrastructure and also human resource wise, if that cannot be done in the hospital, in the health system, it is recommended that patients are cared for at home. WHO recommendation for home-based care: one is for the patient who is confirmed positive, either not symptomatic or they have mild symptoms. And then also in situations where there's patient who has not been confirmed positive, so but has come into contact with an individual who is positive. There's a role for the clinician or the healthcare worker to assess the patient and determine whether the patient qualifies to go home. There's a role for infection prevention and control. Part of it is to make sure that the patient going home will go home into a house which is safe in terms of infection prevention, the ability to have the resources to care for himself at home to prevent infection spread. The third one is for clinical monitoring. So the patient should be followed up and be able to determine whether the patient is deteriorating or improving. And the last one is to ensure that waste management in terms of items used by the COVID patient can be disposed of well in the house. The community should be engaged. Usually the communities, they know the community very well, and with the community engagement, usually they come up with great ideas. Sometimes they themselves will help with monitoring, support healthcare workers who go in and monitor the patients, and we can use technology to monitor the patients. If patients are well prepared in terms of staying at home, make sure they stay within their own room for the period of time that they are recommended to stay home. It goes a long way, can go a long way to support or make it successful on the continent.